Today's video is about multiple choice questions on eye banking and tissue storage. We will be discussing the questions as well as the possible answers of those questions. So let's start. 1. Endothelial decompensation occurs if the endothelial cell density is below A. 2000 millimeter per square, B. 1000 per millimeter square, C. 500 per millimeter square, D. 250 per millimeter square. The correct answer is 500 per millimeter square. Number 2. The coefficient of variation in specular microscopy measures which of the following endothelial attributes? A. Polymegathism, B. Blebs, C. Pleomorphism, D. Guttata. The correct answer is C. Pleomorphism. 3. Enormous corneal sensitivity is due to the thousands of nerves entering into the cornea. The number of nociceptors present in cornea approximates to A. 5500 per millimeter square, 7000 per millimeter square, C. 10,000 per millimeter square, D. 15,000 per millimeter square. The correct answer is B. 7,000 per millimeter square. Question number 4. Which one is not a contraindication for the donor tissue? Hepatitis B and C, B. HIV, C. Lung cancer, D. Syphilis. The correct answer is, of course, C, which is not common given. So here we want to present the bonus knowledge regarding the absolute contraindication of donor tissue for corneal transplant. We have made a mnemonics called RAID HATS with double S, which stands for R. Rabies, E. Encephalitis, D. Death from unknown cause, H. Hepatitis B and C, A. AIDS, T. Tuberculosis, which is the miliary tuberculosis, S. Syphilis, and another S. Septicemia. So if the donor has any one of these non-conditions, then his or her eyes are not suitable for transplanting to another person. Question number 5. One of the following seems the most feasible age criteria to be a cornea donor. If the death occurs at number A. birth to 100 years, number B. 2 years to 80 years, C. 5 years to 70 years, D. 10 years to 50 years. The correct answer is, the most appropriate answer becomes 2 years to 8 years. Even Nepal Eye Bank follows 2 years to 75 years criteria. So among these 4 options, the most appropriate becomes number B. Question number 6. Prior to tissue retrieval, the technician should wash the anterior ocular surface by sterile phosphate buffer saline followed by 3 minutes rinsing of povidone iodine solution. Which percentage should be 2%, 5%, 10%, 12%? So the appropriate percentage of povidone iodine is, of course, 5%. Question number 7. The tissue would not be worth for optical transplantation if the endothelial count is below number A 2000 per square millimeter, B 1500 per square millimeter, C 1000 per square millimeter, D 2500 per square millimeter. The correct answer is 2000 per square millimeter. Nepal Eye Bank follows less than 1800 per square millimeter. So it should be noted that all the options are in per square millimeter, right? So question number 8, McCarey-Kaufman medium, or popularly known as MK medium, is a storage media where we can store the corneal tissue for up to number A 3 to 4 days, B 7 to 8 days, C 14 to 15 days, D 29 to 30 days. So here the correct answer is 3 to 4 days. Question number 9. Optical cornea storage media is enriched with number A mucopolysaccharides and gentamicin, B chondroitin sulfate and dextran, C glucose and benzalkonium chloride, D sucrose and streptomycin. So here the correct answer is, of course, B chondroitin sulfate and dextran. Question number 10. In hypothermic storage modality of donated tissue, the chamber temperature is maintained at A below 0 degrees Celsius, B 2 to 8 degrees Celsius, C 1 to 15 degrees Celsius, and number D minus 10 degrees Celsius. The correct answer is B 2 to 8 degrees Celsius. Question number 11. DSAEK, a type of corneal lamellar graft, stands for number A Desmet stripping automated epithelial keratoplasty, B Desmet stripping automated endothelial keratoplasty, C directly stimulated alloplastic endothelial keratoplasty, D direct stromal automated EP keratoplasty. The correct answer is B Desmet stripping automated endothelial keratoplasty. Question number 12. If a cornea retrieved from a crematorium disqualifies for optical transplant, in that the polymegathism is 80% of total endothelium count, we can do all of the following to this tissue except number A used for tectonic graft, number B used for therapeutic purpose, number C used for research and training, number D discard it in a safe place. The correct answer is, of course, discard it in a safe place. We can do all of the A, B, and C activities, like we can use it for tectonic graft or in the therapeutic purpose or for research and training purpose, but we can't discard it in a safe place. Number 13. When the whole eyeball is enucleated, we can also preserve the severed sclera in 90% ethanol after processing. The preservation period during which it is accepted for surgical procedures is A 15 days, B 30 days, C 6 months, D 2 years. The correct answer is 2 years. Question number 14. The poor candidate for eye donation is A old age, B bilateral cataract surgery, C suspected social behavior. Number D all. Of course all, because in old age the corneal endothelial count is obviously low. In bilateral cataract surgery the endothelial health is compromised. In suspected social behavior there might be communicable disease like AIDS, hepatitis B, etc. and etc. So that all these are the poor candidates for eye donation. Number 15. Event of graft rejection can occur in the recipient in A 6 months, B 1 year, C 2 years, D throughout life. The risk of graft rejection after corneal transplantation is throughout life. Uh, Although the occurrence of the rejection is relatively low after 2 years, the risk is there throughout life. Number 16, which disease warrants and must excellent prognosis in penetrating keratoplasty? Number A, keratoconus. B, inactive herpetic scares. C, keratoglobus. D, severe dry eyes. The correct answer is keratoconus. 17. The first human corneal graft was done in 1886 by A. Edward Conrad. B. Von Hippel. C. Ludwig D. Evers Papyrus. The correct answer is Von Hippel. 18. Hospital Cornea Retrieval Program HCRP in Nepal was started in A. 2013, B. 1991, C. 1994, D. 1999. It was started in 2013 by Nepal Eye Bank, established under Nepal Eye Program Tilganga. 19. Nepal Eye Bank was established in A. 1981, 1994, 1995, 2001. It was established in 1994. 20. The first surgeon who performed the penetrating keratoplasty in Nepal is Dr. Devnarayan Saha, Dr. Madan Prasad Upadhyay, Dr. Narendra Dhod Joshi, D. Dr. P.C. Karmachari. The correct answer is Dr. Narendra Dhod Joshi.